My name is Patricia and I'm from Denver. I believe that health is important because when you have insurance, you're able to access a lot of things, and when you don't have insurance, then it's really a challenge, and it's very difficult to try to access any kind of help. I have had health insurance for the last 20 years, but I never really used it. And a couple of times when I did try to use it, what would happen is it was really difficult, like the appointments were set way out and things like that. And so I've been very healthy, but recently at New Year's I got a stomach infection and I'm unemployed. I've been unemployed for 5 months. And so I had no insurance now, all those years of having it. Now I don't have it. And so I had to use the emergency room, and I was in there 3 times, 25 days, just to be able to get my first appointment, to even go check my blood and to kind of follow up with what was going on. Mainly, I really just would make an appointment once a year. My children are grown now, so it was just for myself. And like I said, sometimes the appointments were so far out that I would just kind of forget about them. And because I was healthy and had never been in the hospital except to have children, I didn't. I was healthy. I didn't see a need to go to the doctor. The first time I was like not diagnosed, misdiagnosed, I guess you'd want to say. And then the second time I went back, then they found my blood being inconclusive. And third time I was finally diagnosed with the stomach virus and diabetes. So for me, this has really been difficult, misdiagnosed and having to use the emergency room, and now I have huge bills. It's just like I'm at their beck and call, like whatever they decide to give me, the wrong medicines or something that, oh, well, this one is in case you vomit. Well, I'm not vomiting right now. So it's been very difficult, and like I said, just the co-pays and even the way you're treated in the clinic, that's kind of like, just a lot of questions, and you feel like it's kind of like your fault because you didn't take care of yourself, and when you were healthy, you didn't see a need at the moment. But then at the same time, you're afraid to try to use herbs like my abuelita was also curandera, so I'm afraid to use anything because I don't know if it will affect the pills that I'm on now. You never know until you're in the emergency room and they're telling you all these different things that that you're in a situation where you're really at the mercy of the medical field and what they decide to do with you, and how long you're going to stay there, and the cost of it. The cost is the worst part because you don't know how you're going to pay this big huge bill, but you have to use the emergency room because you can't make an appointment anywhere. Okay, well, I don't know enough about it. I've just heard bits and pieces, and I guess I'm really going to be thinking about that and looking into it now that this situation has happened to me. Otherwise, I probably wouldn't give it a second thought. But now since, all this has happened, I'm going to be more aware, and I'm really going to try to find out, how I can help my family and my community. Is it really affordable? Because even this indigent program, knowing that you have no money, but they still require $25 for a copay, and today they billed me, but in a couple of weeks I have to go back because now my heart's beating too fast. I have $25 then. I don't even have the 25 now. Right. So it's going to be difficult. I think it's really an important topic because, like I said, I think a lot of us, we're just happy and healthy, and we don't think about anything until a situation comes up. And then people that are sick, well, a lot of times they don't know how to access the healthcare providers or resources that are out there. And I don't think there's enough information, period. And then it's the fear factor, I think, of, in nuestra cultura, one of the things that happens is that you really don't go to the doctor. Like you use the drugstore curandera, or you just try to suffer through it, and then it may be too late, and then you're in the emergency room with big, great, huge bills. My biggest message would be to get informed and to find out and to start taking care of yourself, because with all this processed food and who knows what we're eating and everything else, it's all these viruses that are going around, it's very difficult to know exactly what to think at the moment.